New cases in the very vaccinated New York City, according to the New York Times tracker. But it's not quite bad enough to stop ridiculous medical virtue signaling. Listen to this. The New York City guidelines for administering monoclonal antibodies to patients instruct healthcare providers to consider race and ethnicity, I should say, when assessing individual risk, as long-standing systemic health and social inequities may contribute to an increased risk of getting sick and dying from COVID-19. That's right there on the government website for everybody to see. You want to get cured? Well, we got to make sure you're the right color first. Let there be light. Joining us now is New York City Councilman Joe Borelli. Sir, good to see you tonight. What exactly does this mean? I mean, you told me about this story, and I couldn't quite believe it when you told me that the other day. What are they trying to do here?
Yeah, and I had only heard because a prominent physician where I live was so shocked and so appalled by this policy change that he actually reached out to his local politician to try to get some difference or change in this. You know, you read the Journal of Medical Ethics, the American Medical Association ethics guidelines, whatever you want to read, you could see physicians are supposed to treat people the same, irrespective of their race and ethnicity. And here's the Department of Health of the city of New York, in the middle of a genuine bona fide crisis. The cases are rising, the hospitalizations are creeping up as well, actually telling physicians to consider race and ethnicity when doling out life-saving monoclonal antibodies and oral treatments. It's not even unprecedented. It's actually just, it's sad, Rob. It's really something that I take it personally. I'm actually getting emotional over this because it's so frustrating to hear doctors in my community being told how they should treat patients. There's tons of good reasons, perhaps, not to give patients certain drugs or not, prescribe this for a particular person, but race and ethnicity are not one of them. It's
so staggeringly stupid. I mean, I love that you're passionate about it. I hear this story and I just, I don't know what else to do except just laugh. You just laugh at the idiocy of it all. Oh, well, you want to get over your COVID? Yeah, well, you might not be the right color today. We got to figure that out first. Welcome to America in the 21st century. It's just amazing. I want to move on. The idea that the vaccine keeps you safe from COVID has been completely eviscerated in recent weeks. I shouldn't say it keeps you safe from COVID in that it works as a therapeutic. I truly do believe that. I think if you're going to get sick, you're going to get it bad, the vaccine could make it better. The idea that it prevents the spread has been completely eviscerated. And yet New York still has some of these insane mandates in place. They're even kicking unvaccinated kids out of restaurants in this video that we've all seen by now. I mean, this is the state of play right now. That little, what is he, 4 or 5 years old? I mean, he's a little tiny kid, is not vaccinated, and he's getting the boot from like 8 cops at a time when the vaccinated are spreading Omicron like wildfire. I mean, none of this makes any sense, Joe.
No, and this video is appalling. I grew up around a number of New York City cops. One cop I know wants to be that guy who's kicking that kid out of a restaurant under orders from Bill de Blasio when there's real crimes happening on every corner of every street in New York City. Right. That said, you're right. Right now, we're actually doubling down on vaccine mandates, despite the fact that they're being proven inefficient in every case and in every metric possible. I think you're right. They're probably a good hedge for individuals, especially people with comorbidities. And you should think about getting one. But the mandates we've implemented, the rules we've instructed our city workers to abide by, the private employer vaccine mandate that went into effect yesterday, those have had absolutely no impact on the transmission of COVID whatsoever. Our rules have done nothing. The mandates have done nothing but curb everything but COVID-19.
Yeah, and I want to talk for a second because we're moving on. We've got 48 hours left of this idiot running this city. Thank God. I moved here when Bloomberg was just ending and de Blasio was elected. The city was great when I moved here, and it's fallen apart since. Eric Adams takes the job this weekend, right after the ball drops. Obviously, he's much more moderate than de Blasio. I think I see a lot of good signs here for where this city could go. What do you think he does with things like the vaccine mandate? Do you think he makes a change there? Does he, where do you think his politics lie on all this?
Look, I think he's someone who's not afraid to stand up to the teachers union, unlike his predecessor, the guy that's walking out the door. So I don't think he panders to them when it comes to things like school closing. But I am concerned. He is someone who is a progressive. So I am concerned that he continues this nonsense and potentially even goes further and mandates the vaccine for school children. I got to be honest, that might be the final line in the sand for my wife and I, and for a lot of New Yorkers who just can't seem to get past it. He sees the same stats that we do, so he has to be cognizant that what we're doing isn't working. And he said things proactively about not shutting down the city again. So I'm cautiously optimistic, but I wouldn't bet the mortgage on it.
I wouldn't either, but you're right. I mean, I can't see. I don't care where you are. I don't care how liberal where you are is. I can't see more than 35% of parents jabbing a 5-year-old kid with this vaccine. I just can't see it. And that doesn't mean that, maybe they think the vaccine's safe or not. I just don't think that they think it's necessary. And why put unnecessary things into your kid? It's your little kid. It's your precious little kid. You just can't see it happening. New York City Councilman Joe Borelli, thank you for taking the time. The next time I talk to you, de Blasio will be gone. We can celebrate that.
It'll be a good day.
It will be a good day. All right, coming up. At this point, nearly nobody